health reforms are facing criticism from a group of Māori leaders. All 15 Iwi-Māori partnership boards have gathered in Taranaki to propose changes to the Pae Ora Health Futures Act, which they say would significantly diminish their role in the health system, including removing their monitoring powers. They say the changes will silence the Māori voice and cuts it out of decision-making altogether. Louisa Wall is chair of Tūwharetoa Iwi-Māori Partnership Board and joins us now. Louisa, good morning.
Morena, Ryan.
Good to see you.
And you.
Now, the government says this is a necessary step. Getting everyone to look at everything and sign everything off is a waste of money, and this will help us actually make sure the system's not bogged down. What do you say to that?
I say that's a cop-out. And in fact, we were created not only by a Waitangi Tribunal finding or recommendation in 2019, but also by the Simpson Review, which included Sir Brian Roche. So essentially it said that the system was not meeting the needs of Māori, that there were inequalities, and in fact they went as far to say that there was institutional racism within the health system. And so as part of the solution, they created Iwi-Māori partnership boards to ensure we had relationships at a regional level to put patients at the centre of the health system and to enable Māori, iwi and hapu, and we're all mandated iwi and hapu representatives, to speak to how the system could better meet our needs and aspirations. And so from the beginning, it was about ensuring that we addressed things like a 7-year age gap in mortality rates. And so we are willing partners to the system. We want to support the Minister of Health. We want to support the government. And so using this kind of regulation style justification just doesn't wash.
I guess people will be wondering, look, it sounds noble, but the money that we are spending on this, the money that would be spent on this and keeping these partnerships alive, could that not go to the front line? Would that not better help Māori access healthcare?
Oh, absolutely, we should be supporting the front line, but the reality is those reviews highlighted ongoing systemic issues, that the system itself did not have the solutions. And so from a treaty perspective, obviously hapu and iwi want to partner the Crown. We want to be a good partner in ensuring that Māori voices contribute to the design and delivery of services in a way that means we utilise them. I mean, our biggest challenge in the health system is that we are all engaging far too late. Māori going to ED is not a solution. We need Māori engaging earlier. We need to be involved in preventative initiatives, which includes immunisations and screenings, but they have to be, accessibility has to be through a Māori lens, Ryan, and also through a rural lens, a disability lens, a patient-centred lens. And in fact, we are the only entities in the system at the moment that enable that lens to actually shine a light on the system and help transform the system so we get better efficiencies for all New Zealanders. So I guess that's the other thing to highlight. Iwi-Māori partnership boards are really clear that we have manaakitanga or relationships with all people who reside within our tribal boundaries and roles and responsibilities to ensure that all New Zealanders better access our health system.
So where are the iwi at on this? Because if the problem is that Māori aren't going to the doctor early enough, you know, it's waiting until the ambulance at the bottom of the cliff type situation, why can't, you know, wouldn't the iwi be the best outfit to actually address that rather than the government?
Well, we're the manifestation of the iwi though, Ryan. We are mandated hapu iwi representatives, but our role is to work within the system. You know, Māori leaders through the National Iwi Chairs Forum have pou tangata led by Dame Nader Glavish and Rahui Papa. And so the iwi leaders are focused on health reform and ensuring that we have safe and accessible services for our people. But fundamentally, both the Waitangi Tribunal report and the Heather Simpson Review said the issue was the system. It wasn't that Māori didn't want to engage, but the system needs transformation. And so our role is to be that transforming voice and to have a relationship with the Minister, with Health New Zealand, which we want to do. Unfortunately, this Health Minister has put a barrier between that relationship and has given all of the authority to the Hauora Māori Advisory Committee, which are his advisors that he appoints that do not have iwi and hapu mandate. And that is the biggest challenge we see to his proposed reforms, is that he's essentially cutting out iwi and hapu from being able to support the government in their aspirations.
All right, Louisa, we'll leave it there. Thanks so much for joining us this morning. Louisa Wall, Chair of the Tūwharetoa Iwi-Māori Partnership Board out of Taranaki this morning. Just gone to you.